Good day to see you, dear ladies and gentlemen. Today we will discuss about the anatomy of female reproductive system. So in this diagram, we show all organ of female, all organelles of female reproductive system. So we coming to discussion. The first one is uterine tube, then ovary, uterus, then visi, uterine, pouch, vagina, clitoris. This is the labium minus, labium majus. This is the greater vestibular gland. This is the cervix. This is the fornix. This is the rectouterine pouch. So, what is female reproductive system? Female reproductive system anatomy and anatomy ovaries. The ovaries are a pair of small gland about the size and shape of almond located on the left and right side of the pelvic body cavity lateral to a superior portion of the uterus. Ovaries produce female sex hormones such as estrogen and progesterone as well as ova, commonly called eggs. The female gametes ova are produced from oocyte cell that slowly develop throughout a woman's early life and reach maturity after puberty. Each month during ovulation, a mature ovum is released. The ovum travels from the ovary to the fallopian tube where it may be fertilized before reaching the uterus. So now we are coming to discuss with you fallopian tube. What is fallopian tube? The fallopian tube are a pair of muscular tube that extend from the left and right superior corner of the uterus to the edge of the ovaries. The fallopian tube ends in a funnel shaped structure called infundibulum, which is covered with a small finger-like projection called fimbriae. The fimbriae swipe over the outside of the ovaries to pick up, release ova, and carry them into the infundibulum for transport to the uterus. The inside of each fallopian tube is covered in cilia that work with the smooth muscle of the tube to carry the womb to the uterus. So now we are coming to discuss with you uterus. What is uterus? The uterus is hollow, muscular, pear-shaped organ located posterior and superior to the urinary bladder, connected to the two fallopian tube on its superior end and to the vagina via the cervix on its inferior end. The uterus is also known as the womb as it surrounds and supports the developing fetus during pregnancy. The inner lining of the uterus, known as the endometrium, provides support to the embryo during early development. The visceral muscle of the uterus contracts during childbirth to push the fetus through the birth canal. Now we are coming to discuss with you vagina. What is vagina? The vagina is an elastic muscular tube that connects the cervix of the uterus to the exterior of the body. It is located inferior to the uterus and posterior to the urinary bladder. The vagina functions as the receptacle for the penis during sexual intercourse and carries sperm to the uterus and fallopian tube. It also serves as the birth canal by stretching to allow delivery of the fetus during childbirth. During menstruation, the menstrual flow exits the body. Why the vagina? Now we are coming to discuss with you What is vulva? The vulva is the collective name for the external female genitalia located in the pubic region of the body. The vulva surrounds the external end of the urethral opening, and the vagina include the mons pubis, labia majora, labia minora, and clitoris. The mons pubis or pubic mound is the raised layer of adipose tissue between the skin and the pubic bone that provide cushioning to the vulva. The inferior portion of the mons pubis split into left and right halves called the labia majora. The mons pubis and labia majora are covered with pubic hair. Inside of the labia majora are smaller hairless folds of the skin called the labia minora that surround the vagina, and a vaginal and urethral opening on the superior end of the labia minora is a small mass of erectile tissue known as the clitoris that contain many nerves ending for sensing sexual pleasure. Now we are coming to discuss with you breast and mammary gland in female. The breasts are specialized organ of the female body that contain mammary gland, milk duct, and adipose tissue. The two breasts are located on the left and the right side of the thoracic region of the body. In the center of each breast is a highly pigmented nipple that releases milk when stimulated. The areola is a thickened, highly pigmented band of the skin that surround the nipple protect the underlying tissue. During breastfeeding, the mammary gland are special type of pseudo-reperous gland that have been modified to produce milk to feed infant. Within each breast, 15 to 20 clusters of the mammary gland become active during pregnancy and remain active until milk is no longer needed. The milk passes through milk duct on its way to the nipple where it exits the body. Now we will discuss about female reproductive system physiology. So what is the physiology of the female reproductive system? The female reproductive cycle is the process of producing an ovum and readying the uterus to receive a fertilized ovum to begin pregnancy. If an ovum is produced but not fertilized and implanted into the uterine wall, the reproductive cycle resists itself through menstruation. The entire reproductive cycle takes about 28 days on average, but maybe as short as 24 days or as long as 36 days for some women. Oogenesis and evolution under the influence of follicle stimulating hormone and luteinizing hormone, the ovaries produce a mature ovum in a process known as ovulation. By about 14 days into the reproductive cycle, an oocyte reaches maturity and is released as an ovum. Although the ovaries begin to mature many oocytes each month, usually only one ovum per cycle is released. Now we will discuss about fertilization. So what is fertilization? Once the mature ovum is released from the ovary, the fimbriae catch the egg and direct it down the fallopian tube to the uterus. It takes about a week for the ovum to travel to the uterus. If sperm are able to reach and penetrate the ovum become a fertilized zygote containing full complement of DNA, also known as deoxyribonucleic acid. After 2 week period of rapid cell division known as the germinal period of development, the zygote form an embryo. The embryo will then implant itself into uterine wall and develop there during pregnancy. Now we will discuss about menstruation. So what is menstruation? While the ovum mature and travel through the fallopian tube, the endometrium grows and develops in preparation for the embryo. If the ovum is not fertilized in the time it is failed to implant into the endometrium, the arteries of the uterus constrict to cut off blood flow to the endometrium. The lack of blood flow causes cell death in the endometrium and eventual shedding of tissue in the process known as menstruation. In normal menstrual cycle, this shedding begin around day 28 and continue into the first few days of new reproductive cycle. Now we will discuss about pregnancy. What is pregnancy? If the ovum is fertilized by a sperm cell, the fertilized embryo will implant itself into the endometrium and begin to form an amniotic cavity, umbilical cord, and placenta. For the first 8 weeks, the embryo will develop almost all of the tissue and organ present in the adult before entering the fetal period of development during week 9 through 38. During the fetal period, the fetus grows larger and more complex until it is ready to be born. Now we will discuss about lactation. What is lactation? Lactation is the production and release of milk to feed an infant. The production of milk begins prior to birth under the control of hormone prolactin. Prolactin is produced in response to the suckling of an infant on the nipple. So milk is produced as long as active breastfeeding occurs. As soon as infant is weaned, prolactin and milk production ends soon after the release of milk by the nipple is known as the milk let down reflex and is controlled by the hormone oxytocin. Oxytocin is also produced in response to infant suckling so that milk is only released when an infant is actively feeding. Thank you, dear ladies and gentlemen.